At Augusta Dental Center, we will treat toothache emergencies if you have one. We don't want anybody to be in pain, and we routinely, daily, take care of folks who have a toothache emergency. Please know that we do treat dental emergencies. There are certain parameters that we use, and I want to tell you about the process we go about doing that, because it's very important if you want to be seen. It's ideal if you call us and let us know that you're in pain so we can try to schedule you if we can. Normally what happens is we have a lot of people call, and they come in first thing in the morning when we open. We'll have you do a health history and a preliminary triage so we'll know if it's something we can do. For instance, if you've got huge swelling in the floor of the mouth and it's caused by a wisdom tooth that's not erupted and it's encased in bone, we would not be doing that at Augusta Dental Center. That's something you're going to need to be under general anesthesia to do. In cases like that, we would know that immediately after our triage and send you to an oral surgeon. We could refer you to one to make sure you got in to see them. After that, we will make a panoramic x-ray, and everybody that we treat has to have a panoramic x-ray. I will not treat you under any circumstances without that x-ray. I have to be able to see what I'm doing. And so there's no exceptions to that rule. Many times people have a little small x-ray they brought from their dentist, and I will not use that. I've got to have one that shows, panoramic shows the whole jaw and all the surrounding structures. It's very important to be able to do that. So after we get you into the system, we make that panoramic x-ray, and I can do a preliminary diagnosis. Make sure that it's something that we can treat. Then you'll be worked in amongst our regular scheduled patients. Sometimes you will have to wait a while. I mean, there's no getting around that. I'll tell you that up front, because what I'm doing is between other patients that come in for denture services and implant services that we're doing, I will have you waiting in one of our treatment rooms, and I'll come in and take care of you, and then you'll be done. So there is usually some waiting involved with that. The reason people are willing to do that, and we don't like for you to have to wait, but many people can't go somewhere else because they can't afford $300 or $400 for an extraction. And so we understand this, and that's one of the basic premises of Augusta Dental Center, is we want it to be affordable to you, and we take a great deal of pride in being able to provide those affordable services. So let's talk about those fees and what you can expect. The panoramic x-ray that we have to take is $55. Everybody has to have it, no questions asked. If you have a simple extraction, the fee for that is $95. Now, that's a tooth that we just go in, and with a forceps extraction or elevator, we take it out, okay? If we have to do anything surgical, remove any bone or section of tooth or anything like that, do any suturing, it becomes a complex or a surgical extraction. Surgical extractions are $150. So to know what to expect, a surgical extraction is going to be $150 plus $55. Now, can I tell you before you start that it's going to be a simple or a complex extraction? No. These extractions, many times it looks like it's going to be simple, but the tooth is fused to the bone and it becomes a surgical extraction. So I'll be prepared to pay the surgical extraction and the fee and the x-ray fee, the panoramic x-ray fee. The one thing you have going in your favor is I'm lazy. I like for them all to be simple extractions, so we'll be working hard to make that happen. Now, if many times we have folks that come in with someone else's credit card, their parent or their boss or somebody's credit card, the person whose name is on the credit card has to be present in the office to sign for it, and they have to have a picture ID identifying them in the office with them. There's no exceptions to this. We don't do any telephone charges, and we don't do any signing of someone else's credit card. As simple as that. There are no exceptions to that rule. So we look forward to seeing you. If you have a problem, give us a call. We want to help you. I just wanted to give you a little bit of background on the parameters that we use to doing that, and we don't vary from that much at all. It's pretty much a straightforward thing. So if we can help you, let us know.